Hi, good evening, everybody. And I'm very happy to see that we've got a fair collection of would-be researchers that's already joined. This is Dr. Madeleine Muller here from the Rural Doctors Association of South Africa. We're in our last week of rural onboarding. It's been a long 8 weeks with lots of very exciting webinars. I know it's not possible to get to everyone, but all of these webinars are uploaded on the Rudaso YouTube channel. So please do go and check them out, freely available and free to share. And this evening, on the last week of our onboarding, we always have a non-clinical topic. And I'm very pleased tonight to have my very own HOD, who I've had the real privilege to work with for the last 3 years now. And Dr. Adeniyi is going to speak to us tonight about research in a rural district setting. And what we really would like is all the observations, all the things you're learning, all the things you're experiencing out there, that we actually get that published as a way to also share what is happening in our facilities with the wider world. So Dr. Adeniyi is a senior lecturer in the Department of Family Medicine and Rural Health at WSU, and he's also the head of the clinical unit of A&E at Cecilia Makiwane Hospital at Mdantsan here in East London. Dr. Adeniyi is a passionate clinical teacher and clinical scientist. He's a National Research Foundation C2 rated researcher, and he's currently mentoring postgraduate students at the Faculty of Medicine and Health Sciences of WSU on research designs, implementations, scientific writing. And there's several of our registrars who has gotten their MMeds, who has managed to get them through their MMeds. He has won several honors for his research outputs in the past 10 years. And among others, he's recently won the 2023 Vice Chancellor Distinguished Researcher Award and the 2017 Emerging Researcher Award from WSU. He successfully graduated a PhD and several MMed students in the past 5 years, and he currently serves as a respected member of the Research and Innovation Higher Degrees Committee and Research Ethics Committee of the Faculty of Medicine and Health Sciences at Walter Sisulu. He's also an active member of the local hospital institutional review board and an ardent reviewer for several local and international journals. He currently collaborates on different research projects locally and internationally, and chairs the Resuscitation Committee. And as you can see, he's very hands-on, and he's been very hands-on in actually helping to get not only registrars, but interns, anybody who's keen to publish, and Dr. Adeniyi will help get you published. So we're really excited to have him sharing some top tips for us today to make this actually a possibility in our rural health facilities. I'm going to stop sharing my screen, and Dr. Adeniyi, I'm very happy to hand over to you. Just a reminder, if you want CPD points, please enter your name and registration number in the chat. But we'll also have a poll at the end to help confirm who's actually attending.
Thanks very much, Madeleine. I'm very privileged to join this this platform to share my experience. And largely, most of the things I will be covering will draw from my own personal experiences over the years, but try to make it as practical and straight to the point as much as possible. Actually, for most of the doctors, you will know that we did not have the opportunity of receiving training in research methodology as part of our undergraduate program. And often than not, that creates some form of gap in terms of learning, and more importantly, for us to be able to implement. Are you able to see my slides now? Can you see my slides, Madeleine?
Yes, very well. Yes.
Oh, great. So over the next hour, I just want to take us through the research process, and more importantly, the often confronted challenge of doctors working the districts and CHCs centers around where does my research topic come from? And then, of course, putting pen to paper in terms of writing up a research protocol, and then, of course, how you can share your findings. I took this paper from a very nice publication by Fetis, which came out in the Journal of Family Medicine and Community Health, published in 2019. And this is a very important resource, which I will encourage everybody to look at this paper. And it's essentially saying that doctors working at the forefront are actually interested in research, but often than not, the knowledge and the experience is not often there. And therefore, that creates a challenge. And we know specifically that research, healthcare research is very, very important in terms of advancing our knowledge within the sphere of knowing more about the diseases that we are managing in terms of the treatment we are providing for our patients. What about the outcomes of this care, of the care we are offering our patients? But better still, we want to look for better ways of improving, preventing these diseases and promote health in our patients. And research provides us that opportunity for us to be able to actually, bring out new knowledge and push the frontiers of knowledge in all of these aspects. And it's important that we recognize that a lot of the medications, the vaccines, and devices that we apply in day-to-day in our day-to-day practice, often than not, may have actually emanated from animal studies through preclinical trials, and then before it gets to the clinical trial stage, in which are then implemented in humans. And therefore, a lot of knowledge, again, through animal researchers, which again, for those that may be interested in pursuing anatomical pathology, they often are not be familiar with a lot of researches done in this field. And also, there are a lot of tissues, biological tissues and materials, either from deceased individual or part of the tissue of an individual in form of embryo, fetuses, or fetal tissue for obtaining following termination of pregnancy. All of these are often utilized for research purposes. And therefore, the process involves systematic collection of data synthesis, and analysis with a view or a goal of enhancing new knowledge or new information. And also, we are hoping that whatever information or for whatever we find from this process can then be generalized to improve human condition in the environment we have to live. Okay. Now, this is just a schema, just to give us a conceptualization of what is the journey, what does the journey looks like in terms of making decision to embark on conducting a research, irrespective of where you are placed. But most of the things I'm going to talk about will focus largely on researches that we can conduct where we work, whether we're in the CHC or PHC, district hospital, regional hospitals, and the journey will essentially be the same. Okay, we'll start by you having an area of interest, something that has piqued your interest, which we can then identify as a researchable topic, and from which we can look at, formulating a question from. And then we need to go through this process of developing a protocol, which I will take you through. And very, very important, often or not, that we may want to test our ideas of the protocol implementation on a select few participants and see if there is a chance that this project can be implementable, and therefore we gain some couple of answers around the logistics as well as the implementation profile of the project. And if there will be any need for us to review the protocol, we then can use the feedback from the pilot test to then do that. But more importantly, any information that we are gathering systematically that will involve us to make some synthesis of information, and then, of course, sharing of the data outside of our place of work will require ethical application process. And I think that is very, very important, that we are not permitted to share data of patients outside of your workplace. In order for you to do that, you then have to provide a written report in form of a protocol and to an authorized ethical body, to which then needs to review and look at the scientific merits and the relevance of whatever it is that you want to investigate, and of course, the rest of the process will then follow. For degree purpose researchers, ideas about what to research on can come from different settings. okay? But for the purpose of what we are doing today, primary care researches largely should be coming from the clinical stories and clinical observations you are making from where you work, okay? And I've put a number of, I've provided a typical scenario of a patient that we can see in any of our patients. And this is a case I picked for purpose of discussion today. I indicated here that you made an observation in your clinic today that most of the patients over the age of 40 years have at least 2 or more diagnoses. That is just an observation from patients coming through your door. And if you have a chat with your colleague who may have sat in the other room or consulting room, we equally have made the same observation. And this, you notice that these patients who are not happy with the number of medications they have taken, or they are taking daily or multiple times in a day, with no definite endpoints for managing their chronic conditions. And some of these patients, they actually are inquiring if there is a way to reduce or stop some of these medications. This is a typical story of our outpatient clinic. And now, when you look at this story, what comes to mind readily are lots of questions around, one, can we have an interventional screening strategy for heralding multimorbidities in adult patients presenting to our clinics? That can be an area of focus for research based on this observation. The other question or potential area of research into a researchable topic is, what are the common patterns of multimorbidity in adult patients at your clinic? That in itself is something that you can profile over a period of 2-3 months, just to give us an idea of the kind of patients that you see in your clinic. How many of them have got 2 conditions? How many of them have got 3 conditions? How many of them have got 4 conditions concurrently in your clinic? And the implication thereof is that these patients are going to be on polypharmacy, compulsory or mandatory or rational polypharmacy. And the implication thereof is that what are the pattern of treatment for these patients, which can be profiled? What about the ability of the patients to adhere to using these the different drugs for these conditions? What are the potential drug-drug interactions that can emanate from the multitude of drugs the patients are using for their conditions? What are the chances that they are going to develop adverse events? Can we monitor the incidence of these adverse events from this multitude of medications these patients will be exposed to? And how many of these patients will achieve treatment targets for each of these conditions in which they may be exposed to? And each of these topics can be looked at by different people still working on this same observation. That is the beauty of research. Everybody take a piece of the pie, and you want to dig into it and come up with very important findings. Now, we've come up with topics that we can research, looking at different angles of this based on this observation from our clinic today. What then are we then supposed to do? The next thing is we want to look at what is it that is already known on this particular topic or this condition or this area of interest of ours. Now, literature review or survey of the literature is just essentially a way of, mastering the information that is already out there. And it answers the question, what is known on this particular topic? So the more you read, the more familiar you are with scholarly engagement within the focus of your area of interest. And then as you read and survey the literature, you begin to gather information around how the theoretical framework, as well as how each of the previous authors have gone about answering their research question. So it's not just only to survey the literature on what is known on the topic, but equally you gain an idea of how you may go about implementing your own study, which is the methodology. But more importantly, you want to equally see where are the gaps on this particular topic. How many people have looked at this topic in your context or within the same country or within the same similar setting across Africa? But more importantly, where is the gap? Where did the other authors, where did they stop in their investigation? How then can you advance knowledge on that particular issue? These are some of the critical, benefits of surveying the literature on this particular topic. Now, if you have identified a topic, you can then begin to formulate what we call keywords. These are just a combination of words or what we call phrases that helps us to dig deeper into the literature to gain more knowledge on that particular area of interest of ours. But more importantly, I would recommend that when we are searching the literature, we must look for credible sources, okay? And I've provided a list of areas, reliable databases where you can get very useful papers to read. Often than not, people are worried that they do not have access to libraries. Even ordinary Google do a lot of good. There are a lot of very important papers that are available online free of charge. And that should be enough to get you going. Otherwise, if you have specific paper of interest that you must read and you cannot, and they are requesting you to pay for it, this is where you then need to connect with any of the school library and librarian, and they can assist you to put those papers out, okay? But again, I must make a distinction here that there are what we call gray literature, which are equally, they provide very useful information, but that cannot be the entire focus of your work. For example, newspaper report indicating a bout of cholera in any part of the country. That is a useful information that you can cite in your work, but you still need to have original papers that's coming from any of these other sources, okay? In surveying the literature. When you read these papers, we often want that for emerging researchers, it's important that you don't limit your reading to only abstract of a paper. Abstract is just an appetizer. And often than not, we expect that for you to cite any paper when as you select papers for reading, you need to look for full papers so that you can have a clearer picture of what it is that they have done in any paper. As a general overview, I always say the last paragraph of the introduction, that is where you will find objectives or the aim of the study, which should be clearly indicated, and they are going to provide rationale why that study or justification why that particular study has been conducted. So in majority of the papers, you are going to lay your answer. That is usually the location to identify the aim and the justification for the study. However, these can be part of the introduction of the paper or anywhere within the introduction. But as a general rule, that's where you see it in the majority of the papers. As you read these papers, the question for us, especially when you go to the discussion part of every paper, the paper where they tell you which areas were not looked into in that particular paper. That would be where your own study can start from. The gaps that have been left behind, or if there are specific limitations highlighted by the authors in their work, or additional limitations that you may have picked through your critical review of those papers, that equally helps you to then look at how better, the best way to develop your own research work so that you are not just only gathering data, but you equally want to add to existing knowledge on that particular topic. Now, in terms of putting pen to paper, when you begin to draft your own protocol, it's often recommended that you have a structure. Okay, you must develop a structure in terms of your writing. You know, we generally recommend that when you write your literature review, you must have an introduction, the body, and a conclusion of the literature of your literature review. But often than not, what guides what goes into your literature review is largely based on the objectives that you have identified, that you want to investigate in your study. Literature review is not an essay. When clinicians write about looking at coronary syndrome managed presenting at district hospital, that is not when you want to write about the pathophysiology of acute coronary syndrome. That is not what literature review is all about. But of course, if you are looking at biomarkers of acute coronary syndrome, you may want to provide a critique of the literature on which markers have got the best predictive value or which one has got biases specificity. But again, that is the context in which your literature review should be documented. Just to put this flow diagram just to show you how to go through the databases and then which papers are you have finally included in your work. And also, it's important to learn to provide a synthesis of the literature. And we want to hear your voice. We want to you don't just take a paragraph for one paper and put it in your work. You have to read the paper, interpret what you have understood from the paper, and you write in your own words and then provide reference. So from the source of that particular information. But equally, you need to do what we call critical appraisal, in which case we'll expect that you equally will highlight what may be considered as a strength of that particular paper, but more importantly, you want to highlight which gaps or the weakness of the paper. If the sample size included in the paper was too small, then you may want to then push your own number. You may want to increase sample size. If they have used only one center, you can then highlight that because there is only one center study was conducted, therefore, it may limit the external validity or the generalizability of the findings of the study. By implication, if you are looking at repeating the same study or a similar study, you may then want to look at multiple sites, and therefore the methodology has to be more robust so that your result, if it's in agreement, you then corroborates the finding from a smaller study, which makes the findings even more useful. And also, if your result is completely different from what was reported from a single center, then therefore it becomes it therefore means that you study from multiple centers using the same population, and you've spend time to equally make sure that the sampling is equally very good, makes your studies more likely to be believable than the previous study. So these are some of the things that we need to see in your work. Now, I've provided a very nice, what I call a structured review of the literature. As you begin to pick up papers from the literature, you must have a system of how these papers should be critiqued. And this is just a table showing when the paper was published, the objective that was looked at, the population that was selected and studied, and what are the key findings of the study. But more importantly, what are the limitations, what gaps have not been studied, or what are the recommendations for further studies in this particular based on that particular topic. These are the areas that will give you a guide as to how you can contribute to that particular topic, in the literature. And for those who are considering a degree purpose research, for you, before you even start writing anything, I always recommend read 20 papers on that, 15 to 20 papers on that particular topic. And I've given a structure because we want to know what is happening in the global space, worldwide, and within the African setup, so that we can then see if what you are looking at has been extensively studied, and look at the concurrence in terms of findings in different countries in Africa, and look at within South Africa, and then come back to Eastern Cape or whichever province you are based. Look at studies that have been conducted on that particular topic in your region. Now, your study then must be pushing the boundaries of knowledge on that particular topic, and by looking at all the studies done in your province or in your region of the province, that helps you to know what else is left on that particular issue, so that you can then, contribute meaningfully from your work. If you have done that, you need to then have a structure to your writing. I will always say, for emerging researcher or somebody considering doing research, you cannot learn how to write perfect protocol in one day. And you can learn it in a month. You can learn it completely in a year. But so you need to start from somewhere. So you dedicate yourself, just write the way you know how to write. Okay? Don't stress yourself that the writing is not perfect. It may not be perfect. Okay, so and therefore what is important for us is to just start writing. As we are reading, we are writing something, and we can always come back at the end, after maybe if you've dedicated 2 weeks to do the writing, you can always come back and fine tune. Okay, and even get a colleague of yours to read, even if it's only just to read for English. And of course, if you can identify a mentor to guide you through the process, that makes your life easier in terms of guiding your work through. But it's important you give allowance of 1 to 3 months to allow for ethical approval to be conducted, because most universities and few independent ethical authorities will take plus or minus 1 to 3 months for a non-degree purpose research to be evaluated, and then can then be awarded the clearance to go proceed with the study, and give allowance for you to implement your study. Some studies you may be able to conduct in a week if the participants are readily available, and then and you, depending on the number of patients or participants that needs to be interviewed or surveyed, but it may be longer. So it's important to be able to give allowance for those, especially for our doctors who are doing community service. If you have got only a year to spend for community service, the small piece of the pie that you want to investigate should be such that you can complete within a few months, so that you can be able to get at least make sure you implement and get the data before you complete your rotation or your posting in that particular center. And it's important that you understand that you will need assistance of some form of statistician, or somebody, if you are doing qualitative study, somebody to help you interpret and make sense of what information that have come through during interviews. So you must equally give allowance for time to engage the stakeholders. It helps if you have conducted a study that people, if possible, the patients or the participants can get feedback from your study. And if it's not possible, the hospital or the setting in which the study has been conducted, there should be some form of feedback on the work you have done. And of course, your peers through conference and publications to a wider audience needs to follow. In terms of the writing, putting pen to paper, you want to give a broad statement of the problem within the first paragraph of your draft, and highlight the goal of the project. And of course, we want you to provide what we call problem statement. Often than not, people think it's just one sentence. It's actually not true. It can be a paragraph, it can be 2 paragraphs, it can be 3 paragraphs, depending on what you are writing about. And you simply want to tell us this is what is known, and this is the magnitude of this problem, and its implication for policy, for clinical practice, okay? And for the population at large, you want to highlight that very briefly in a paragraph. And then what else is unknown? So that this is very, very important. The weaknesses you've identified or the gaps you have picked up in previous studies equal, and then you need to then contextualize that so that the proposed study then you've created a bridge for the proposed study so that at least anybody reading your work can see where Shango you are tackling of the problem. It's also important that you must provide a justification or a motivation for your study. My mentor once told me that if you're writing a motivation for the study, for any study, it's essentially like you're a lawyer trying to plead your case in court to convince the jury. And you need to show how important it is for you to conduct this new study. And more importantly, you can give us an idea of who, what kind of the findings that you make that may come up from your work, and how will that change the current practice and policy. If you have done that, then it's important to be able to formulate a research question, which again is just saying for the aim and specific objectives. Then this is just essentially saying, if we have identified a problem, now we need to formulate the aim and objective of the study before we can plan and the implementation part of the work. Now, the aim, or in some work, you come across general objective of the study or the purpose of the study is essentially referring to the same thing. It's just the overall goal of what it is that you seek to achieve in a particular study. And therefore, in order to achieve this broad aim, you may want to break it down to smaller steps that will cumulatively come to the issue of the overall aim of the study. And the objective specifically breaks down the aim into several components, but more importantly, define the focus of your work. And also, it must be at a level that you can immediately begin to see the identifiable variables that will assist you to measure those things, when you go on the field for implementation of your study, okay? And also, it clearly would delineate the scope of your work when you have broken them down to specific objectives. While the research question, often than not, is just putting your aim into in the question format, which, and it will clearly define the scope, the depth, and the overall direction of your work. You will come across this in your reading, what we call final objectives, which talks about the feasibility. Again, in terms of it doesn't matter how beautiful or how passionate you are in terms of conducting a study. If the implementation is not going to be feasible, it's not worth pursuing. Okay, like I made reference to a community service doctor, where if you have got only a year, except if you are working with a team of other doctors who are equally as passionate as you are, often than not, your research work needs to be limited to just that 1 year that you are going to spend in that hospital. And you must equally be asking yourself, do you have resources to, in terms of time, the personnel to assist you, and the funding, as the case may be. But I can tell you, a lot of small researches can be conducted in this hospital, or CACs that would not require a lot of funding. Perhaps the goodwill of your peers is what you need as resource, and they can equally assist you to complete a small survey when they finish consulting their patients, and that is one of the things that can be utilized in the district hospital setting. Now, so your area of interest or topic interest must be interesting. More importantly, it must be interesting to you, because if the moment you start writing, you start reading the literature, you start putting pen to paper, it is something that is of no interest to you, there is a chance you are going to abandon the project. For purpose of non-degree purposes, novelty, it's good, but otherwise even if it's just for you to describe the situation of or a condition of or conditions of patients in your practice population. It may not necessarily be a new. It may not necessarily push the boundaries of knowledge in that in that particular discipline, but it can still be done. Okay, but for PhD at a PhD level, we expect that students who pursue PhD, novelty is a critical part of the deliverables of a PhD degree. Okay, and of course, ethical application, and the relevance in their field is very important. And a lot of when you formulate objectives, important that the terminologies or the way the order in which the objectives are phrased has to be chronological, and also it must flow logically from the problem statement. Sorry. When you are writing your paper protocol, we want you to use what we call action verbs. I've highlighted a few that you are going to see, to determine, to examine, to explore, to test, to describe, to characterize, to assess, to compare. These are the kind of action verbs that you can use when you are formulating a research objective. However, I must equally point out that there are certain verbs, what we call biased verbs, in which case if you write that you want to show that this treatment is better than the other one, we cannot be sure upfront until the study has been carried out. So if those kind of verbs seem to suggest that you know the answer to your research question and therefore should be avoided, to illustrate, to prove, to indicate, to demonstrate, to validate. These are biased verbs that must be avoided. Please take note of the common pitfalls that we often see in write-ups of, the people or students or anybody who wants to do research work. We want to avoid these challenges. Once you have formulated the aim of your study, it's important that we can translate that into a researchable question. Into a researchable question. And the PICOT question is just essentially looking at the components of how the question should be phrased. The patient or the population of study must be clearly defined. What is it, the intervention or in observational study exposure that is of interest to us? There must be a comparator, whether in form of control in clinical trial or a comparison group in terms of observational study that we are looking at. And what is the outcome of interest, which again, we should be able to discern by reading the research question that you are formulating. And of course, a time frame is always important. If you have done that, then we are faced with having to provide justification for how we are going to implement the study. And there are different options in terms of design that we can implement. Largely for doctors, we love quantitative study. We love dealing with numbers. But qualitative study, though emanated from social sciences, we're beginning to find deeper meaning to issues that we see in clinical practice. And these methods combine both. And both these can actually be done, especially when we want answers that the numbers may not actually do justice to alone. So you may want to combine both quantitative and qualitative study design. But more importantly, where you are going to implement the study must be described in detail. What population of interest to you that you want to carry out your study on? If you want to study adult patient with hypertension or adult patient attending the selected CHCs, you then need to define what do you mean by adults. Are you looking at those over 60 or over 50, over 40, over 30? So those must be clearly defined. That cannot be left to the imagination of the person that will review your work. How are you going to recruit this patient? That talks about the number of people to be included and how you are going to assess them. Okay. These must be clearly defined, and you must have what we call inclusion and exclusion criteria. But more importantly, the process of obtaining the data must be described in detail so that whoever is looking at your work can make sense out of it. This is just putting study design into a graphical form. We know that a lot of the studies that have been conducted in the hospital, especially self-initiated research, will be observational in nature. And I specifically highlighted cross-sectional study, or more importantly, retrospective study of more of a clinical audit of file of patients. That's essentially what we do mostly. But again, we are not going to have sufficient time to cover the issue of this, but just for us to be aware that when you survey your patient directly, it saves you time, it saves you cost, and you're able to be in control of the information you want to obtain and minimizes that some people disappear on you during the course of your study. But it's got its own implication in terms of the limitation or robustness of the study that you have conducted. How you sample your patients or the participants into your study could make or mar the work you want to do. And often than not, we are unable to assign a causal relationship within a cross-sectional study. And once we know this upfront, it then gives limits to guide us on what we want to do. More importantly, it's important, the data collection sheet must define the variables, and the variables must speak directly to the objectives of your study. And these are some of the additional components that we expect to see when you put your pen to paper on developing your protocol. I've just detailed the steps to follow when you want to design your instrument. Okay, everything starts from your study objective, and you may even need to pilot or find another process of validating the tool you want to use. One common way is to survey the literature, look at what previous studies have reported, and that helps you, it guides you on what needs to be included in your data collection sheet. But more importantly, when you then test it on a few participants, you can use that to maybe if you have got a mentor or a peer or a colleague whom you can share and review what information that have come through. You may then see if that actually speaks to the objective of your study. Or better still, if you have got an expert on that particular topic, that person can give you a validation on what has come through from the field and during your pilot. Okay. There's quite a whole lot of information on how you can value on what validity and reliability is with regards to your study process, which then speaks to how useful the result will be. But depending on whether you are conducting a qualitative study, I've highlighted what we call 4-dimension criteria for assessing trustworthiness in a qualitative study. Just for those who may be interested in conducting qualitative study at some point in the future, can equally make sure you familiarize yourself with what we call credibility, transferability, dependability, and conformability. These are very, very important to throw in this type of risk, and more importantly, show clearly how you are going to accomplish this in your work so that people can believe whatever is coming from your study. This is just a typical example of a data collection sheet or study instrument. And I specifically highlighted there because this one has been pre-coded to allow for easy analysis. And this can be placed on a Google Drive or a Google Drive, for which allows participants to do administration of the questionnaire or the tool that you want to use. Or if you're using an interviewer-assisted questionnaire, then the whoever is going to, they can easily administer this and complete it on a patient. I specifically highlight the issue of gender here. This has become a major, this is one of the recent changes you're going to see in the literature. So if you simply just pre-code your data as male and female, you are essentially excluding some member of the population maybe who are relevant especially look at the topic of interest. In this particular questionnaire, we call sexual violence, survivors of sexual violence, you know. So if we don't put others here, we essentially, those who self-identify themselves not to fall into this binary, who have seems to have been excluded. And this is one very critical part of how not to design the question, a tool. So again, if you put this, if you pilot this and share with a peer, somebody would then point out that perhaps you neither write all the lists or you provide others, and then they can then specify which one would belong. And this is just to show you. This is how a test for misdesign can follow, where you may then throw in what we call open-ended questions within your data collection sheet, and people can then document what their responses can be. And these responses can then be extracted for qualitative analysis within your project. When you as you put your pen to paper, it's important that you dwell on your data management and analysis component. And these are the key areas of interest. What is your statistical analysis plan? That needs to be documented, and if you are consulting a statistician, we need an indication that that has been done prior to, as part of your preparation for your work. Okay. If you are conducting any research on humans or animals, or tissues from humans or animals, it's expected that this ethical consideration must be taken very seriously. And all the research ethics committee across the country have received serious training with regards to paying attention to issues around respect for human dignity. Okay? And therefore, we need to see that all of the core ethical principles have been well covered in your protocol in terms of autonomy, beneficence, non-maleficence, and justice. And which authorized institution is going to be granting you the approval. And of course, you may still need another layer of approval, either at the community level, or if you are doing study in secondary schools, you may need another approval from the Department of Education and the school. So you must familiarize yourself with all of these processes. And within hospital, usually after they got approval, then the local clinical governance of the hospital or the CAC will need to provide another grant permission on how the study will be conducted. The issue around the incentive for participation in the study needs to be clearly demarcated, and there is a guide on how much can be provided, how much can be given to participants in a study. The essence here is that no individual, due to the increasing cost of living and the lack of work, people should not be induced to making rash decisions as to whether to participate in a research study. And this is one of the reasons why this component needs to be dealt with succinctly in your work. But again, familiarize yourself with studies that can be conducted that will not require that you may be able to grant a waiver of ethical, especially waiver of consent from participants, especially if you're using publicly available data. All you need to do is that you just obtain approval to use the data directly from the sources, and you can be able to. It is always given that the process of harvesting those data will have required that those who collected the data will have followed the normal ethical approval process. Now, so a lot of information are out there in the public domain, like on information on Facebook, on Twitter, on social media, or TV adverts that there are a whole lot of information that you can be able to obtain and make observation of, or you go through the beach and you see behavior of people. Those you can be able to conduct a survey without talking to individual people. But I must warn that you are not allowed to take pictures of people without express permission of such individuals. And also your quality improvement project that you conduct within facilities. Now, we need to make a distinction. You can conduct quality improvement project within your facility without ethical approval. However, if you are going to, if you are going to take the data and the findings out of that facility to share in another platform, then you must obtain ethical approval. And the implication, as I have highlighted here in red, no authorized body or no research ethics committee will retrospectively grant you approval for data you have collected. So if you are conducting ethical approval with a view that you are going to present it in the Congress or present to publish, you better then convert it to draw up a protocol for that QIP and obtain a formal approval process so that you don't then get into the problem of somebody challenging you at some point. And most conferences will publish the abstract of your work. And if you have not obtained ethical approval, somebody in your hospital or your facility can challenge you thereafter, and therefore you then get into trouble for sharing data of hospital. Know the resources that are available to you and where the findings can be shared. Now, essentially, I've taken you through the formalities of how to identify topic for research, how to formulate objectives and aim objective research question, providing justification for your study. Now, again, I've taken you to what study design, what are the potential designs that can be looked at, and the rest of the nitty-gritty in terms of drafting up a protocol. Once that has been done, you need to submit and complete the application process to the to any of the research ethics committee within the university or the private sector. I know NHLS has got they've got their own approval process. So please take note of those that are nearer to where you are based and then obtain approval from such setting. And therefore, the next thing is to then plan your implementation process. Within this hospital, look at something very small that will not require you to spend a lot of money. But if you do have some little money that you can partner with, you can then employ a research assistant who can help you administer your questionnaire to the study participants of interest to you within your study. But you are not allowed to administer any or collect any data until you have got ethical approval certificate from a recognized authority. If you have done that, the next thing is to then get a statistician to help you, will crunch your data so that you can then begin to see what kind of pattern or findings are going to come through from your work. And by implication, if you have done that, the next thing will then be for you to be able to harvest what we call harvesting of paper will then follow, which can not just only for publication, you can present in congresses. And there are a lot of congresses that are waiting to hear from you, okay? And there are a lot of, both locally and internationally, there are congresses or conferences that will pay for you to come and share your findings from your home to anywhere in the world. There are a lot of international conferences that have got funding to pay for your accommodation, your registration, as well as the cost of your flights to anywhere in the world. So please take advantage of these opportunities that are out there. And if you really need to get funding, I know Discovery Foundation supports under individual category for rural fellowship awards. They do give some money, up to 100,000 can be provided for a rural doctor who is interested in conducting researches. But of course it has become very competitive, so which means you may need to get a mentor to guide you through so that your protocol can be competitive. Now, in terms of publication, in 2 minutes, I will just highlight what is important about publication. everything starts with the quality of your data set. And the quality of a data set is informed by the quality of instruments you have to use on the field to obtain the data. Now, when you have spoken, you start with your statistician. I always prefer that once you analyze your data, they need to analyze the data per objective of the study. And most full-length article will be about 4,000 to 6,000 words. So when you pre-select the journal, you then need to see what is the word count expected. Word count is minus title page, minus abstracts, minus tables, minus references. It's mostly the text of the manuscript that needs to be, and most studies will essentially follow the same standard, profile of the standard structure of abstract, which is usually for structured abstract 250 words. Some very few journals allow up to 300, 350, but generally most journals is usually around 250 for structured, and if it's unstructured abstract around 200. Then you are going to provide an introduction, methods that you have followed, and the methods must be detailed enough to allow for replication of your study in another setting by peer reviewers. And the results must be arranged in form of narrative format, tables and figures, which may be just to enhance the quality of the presentation of your work. But more importantly, whatever result that have emanated from your work now must be discussed in the context in which the study has been conducted, and you must compare your findings with previous studies done on that work. Where your findings simply aligns with previous work, you need to document that. But more importantly, where your findings differ from previous reports on the topic, you are mandated to explain the reason for the discordance or for the dissent in your findings. Okay, and of course you are expected to make appropriate, relevant conclusion which speaks to the objectives of the study, and also highlight area for further studies. On the one, the rest of the process is just to highlight to you. And often than not, a lot of doctors get discouraged when they are rejected by a journal. I must encourage you. It's all part of the journey. If they simply reject you, what? They will provide a reason why that rejection has happened. Okay? And usually what we simply do is then carefully take advantage of the comments made by the reviewers for rejecting your work, and then fine-tune, answer those queries on your work, and then repackage it, and then pursue another journal. Often than not, you may get rejected in multiple journals, but invariably, if you have actually put in the effort into conducting a very good work, you will find a destination for the publication of your work. But I must warn you that you must stay clear of what we call predatory journals, because a lot of journals will tell you they are going to publish your work within 2 weeks or publish your work within a month. A lot of those journals are predatory journals. All they want is the money obtained from publication of your work. So within South Africa, there is what we call a Department of Higher Education accredited journals, okay, which are released every year and is available online. Any journal you are going to publish your work must be within that place for it to count towards your career development. I'm happy to answer any of your questions, or if there are practical questions, feel free to type into the chat platform, and I'm happy to provide answers on them. Thanks very much. Over to you, Madeline.
Thank you very much, Dr. Adeniyi. What I loved about this presentation, it just was so comprehensive. It really feels like it's covered all the bases. And what I would ask is if you would email me your presentation, if that'll be okay. And I actually want to add a link to your presentation to the recording, because I think this is an extremely welcome reference tool, that when you actually sit down and decide you're going to do a research project, that it's something one can go back to again and again, and sort of help you take through the steps of the process. So if that'll be possible, I think that'll be really helpful for people to use, and in adjunct to this presentation. So yes, if there are any questions, please put them either in the Q&A or you can put your hand up. I've also just launched a feedback poll, that's just in terms of helping us with the CPD as well. So if you're able to access the poll, please fill in the poll. If you're struggling with the poll, just make sure that your name and MP number is in the chat. And I just want to see at the moment if there's any questions. There's no hands at the moment. And I really want to encourage people to, although it sounds very daunting, if you just follow step by step and just find one person that can mentor you that has published before. There's always registrars hanging around, or specialists who's done an MEd, and just to have somebody that can help you a little bit when you get stuck, but to not feel nervous about getting started. If you've got a little research question in your facility that you think you'd like to do a little research project on, make the effort to do the protocol, get your ethics approval. And it's always very helpful to actually have things published, especially from those very rural areas where we actually have very little information on. A lot of studies are big fancy studies from our big centers. We have lots of information on what's happening in the urban areas. And sometimes we really have very little information on what's happening in a very rural district. So I will encourage you to please publish your work and let us know about your patients and your experiences. I'm just looking, there's no hands that I'm seeing at the moment. I think you've covered all the bases, Dr. Adeniyi. So I'm quite happy to, I know it's already 6:30. I think I'm quite happy to close off here. Dr. Adeniyi, thank you very, very much. I think this was very helpful. And then, yes, I will make the slide presentation available as well as the recording. And I'm hoping we can see some rural papers being published. Thank you very much, everybody.
Thanks very much, Martin. I've shared the slides with you now.
Perfect. Thank you.